If your hospital chart says DNR, does that mean you won't get CPR or go to the ICU? We'll make sense of this alphabet soup today on The Wrinkle. So if you haven't watched before, my name is Dr. Nicole Didyk, and I'm a geriatrician. I'm a specialist in the care of older adults. Right now, in the geriatrician community, there's a lot of talk about how the coronavirus outbreak is affecting older adults and their families. Something that's being talked about quite a bit is advanced care directives. We're being encouraged to have discussions with people about what their wishes are for their end-of-life care or just their medical care in general. I think the subtext of some of those discussions is that we're being encouraged to encourage people to think about putting Do Not Resuscitate orders on their hospital charts if they are sick enough to need to come into hospital. And that's not completely misplaced. But on the surface, it can seem like it's negative or ageist, or that it is placing a value judgment on older adults versus younger ones. Let's talk a little bit about what a DNR is. So DNR could also be called DNAR, which is Do Not Resuscitate or Do Not Attempt Resuscitation. Basically, it means that a person would not be offered CPR or cardiopulmonary resuscitation attempts if they had no vital signs. That's right, no vital signs. That's another acronym, VSA. But basically, it's where somebody does not have a pulse or blood pressure and is not conscious. That scenario is compatible with being deceased. But if you're in hospital and somebody finds that you are in that condition, then they would, by default, usually start to perform a resuscitation effort. That consists of CPR, which a lot of people in the community know how to do. Basically, that is chest compressions, so pressing on the chest around the area of the heart, trying to push the blood out and do the work of the heart while the heart has stopped. It also involves delivering some breath through the mouth, and again, that's to kind of do the work of the lungs. Usually the CPR efforts will take place until more advanced life support system team shows up. In the hospital, that would probably be the crash team or the code blue team. There are different names for it, but that team would be able to administer medications and probably put a breathing tube in the airway of the person. That's called intubation. If somebody survives a CPR attempt, then usually they would need to go to the intensive care unit for more care. It's easy to get off on the wrong foot when there's a discussion about DNR, or code status, as it's also sometimes referred to in hospital. Oftentimes in hospital, the discussion is a little bit awkward, and it seems to really be out of context. It's often framed in a way that makes a person more likely to say that they don't want to be a DNR. So it can kind of be framed like, do you want us to just let you die, or do you want us to do CPR and try to bring you back? Well, if it was framed that way, I think, yeah, most of us would say, sure, go ahead and try to bring me back. But that's because the discussion about DNR can really only take place after we've talked about what a person's overall goals are. And that's not something we often do in hospital. When someone comes to hospital, we're very focused on the reason that they're there and the treatment plan for while they are there in hospital. Oftentimes when you go to hospital, you're being seen by a doctor or a nurse that you've never met before. Someone who doesn't really know you or what your goals or your situation are. So really a discussion about whether or not a person wants to be resuscitated if they have a natural death should happen only when we've kind of talked about what the person wants. If somebody's goal is to live as long as possible, as many days, minutes, and hours of life that they can have, whether or not that involves them being conscious or being in pain, then CPR would make sense in all of those situations because the goal is just to live longer. But if somebody's goals include being able to be conscious, to be free of pain and suffering, then having an allow natural death order might make more sense for that person. For that reason, you don't just have to have a DNR discussion when you're in hospital. In the province of Ontario, there are actually Do Not Resuscitate forms that can be printed off and signed by a doctor or a nurse practitioner. These forms were designed for use in the community because although many people do talk to their family members and even their doctors about their wishes for their end-of-life care, there isn't really a great way of documenting it in kind of a central type of registry. So for example, if somebody dies at home and the paramedics are called, then the paramedics would be obliged to try CPR on the person, even if they've been deceased for a long time or if that was not what their wish was. The community Do Not Resuscitate form is usually filled out, for example, in a geriatrician's office or family doctor's office, and then posted somewhere in the person's home, for example, on their refrigerator. It sounds a bit weird, but it's something that people get used to. And that way, when paramedics arrive, they can see right away that the person's preference is to not have CPR or a resuscitation attempt. Again, if the person is still alive and they need treatment, the paramedics will give that treatment. But if the person isn't alive and does not have signs of life, then the paramedics won't attempt to do a resuscitation. And for many people, that's a very comforting thought. A study that I read recently indicated that in older adults who have a cardiac arrest in hospital and undergo CPR, about 28% have survived at 30 days after the event in the age group from 70 to 79. In the age group of 80 to 89, it's a little bit lower at 22%. And in the 90 and over age group, it's about 12%. And this study mostly looked at whether or not the people survived. It didn't really look at their function or where they were living at those 30 days. The rates of survival are much lower for people who have an arrest outside of hospital, so a cardiac arrest that is not witnessed. So CPR is a treatment that really doesn't bring people back to life universally. I think we're given that impression by what we see on TV. There's a couple of breaths given and a couple of chest pumps, and then the person usually coughs, and they're right back to being who they were before. And that's not usually what happens. What are the reasons that somebody might want to have a Do Not Resuscitate order? Well, going through CPR, again, is not really like it seems in the movies. It can contribute to injury and indignity to a person. If somebody doesn't have vital signs, if they have died, then the CPR can be very invasive and intrusive. It might involve injury to the person's body, and it can also just be very chaotic and almost violent, which is definitely not peaceful and not what most people would think of as how they would want to pass away. Right now as well, with the COVID outbreak, a resuscitation attempt can put a medical team at risk. So the processes that have to be done when a person is being resuscitated can lead to the release of a lot of respiratory droplets and other body fluids that can put a medical team at risk. Usually a resuscitation attempt is done very rapidly and professionally, but because of that haste, there can be increased risk. Now, most medical practitioners will say that the most important thing is the patient's care, and most practitioners are willing to take some risk to themselves. But as a system, it really makes less sense to do a procedure that could expose a team to risk without providing any additional benefit to the patient. So that's something that I think is kind of prompting more of these discussions about DNR, or allow natural death, or AND, because of that increased risk. Not to mention the use of equipment and resources that go into a resuscitation attempt that, again, might not be successful, and the resources might be sorely missed somewhere else in the healthcare system. So I hope this video has been helpful with clarifying some of the alphabet soup that you might hear medical people talking about. I hope that you'll think about Do Not Resuscitate more as an AND, or allowing a natural death, because really most of the time that's what it is. Cardiopulmonary resuscitative efforts are really meant for certain medical conditions, and they're not likely to reverse death in most cases. So in a lot of ways, and for a lot of people, if we really think about what our goals are, it doesn't make a lot of sense. It's also important to know that if a person has a DNR order, it does not mean that they will be deprived of any other attention or treatment. It just refers to that specific part of a treatment plan. I'm going to leave some resources if you want to read more about DNR or advanced care planning in general. I'm also going to leave links to some public health websites that have excellent resources about the coronavirus. And as always, if you want to know more about aging, go to www.thewrinkle.ca.